the Spinal Truth Show weekly podcast edition. I'm your host, Dr. Caleb Slater, here with an esteemed colleague of mine, my wife, pelvic floor women's health expert, Danielle Slater.
Thank you for having me again.
So this week's topic is an odd topic, brain fog. And just to let you know, next week we actually have an interview with somebody who I treated and probably had the worst case of brain fog I've ever encountered. So stay tuned this week and next week. Next week you can actually see somebody who was treated for this in this thought process and this, this treatment approach. If I told you 5 years ago that we'd be sitting talking about treating brain fog, what would you have thought?
Yeah, I wouldn't have pictured that.
Did you even know what brain fog was 5 years ago?
No, I was just thinking that until the post-COVID era, I wouldn't have been able to. We never learned it in PT school. It wasn't part of this cluster of diagnoses and symptoms that patients were having.
No, and
not for PT.
For people out there, I'm assuming it's become a popularized term because of COVID, post-COVID, right? But what is brain fog? It's basically a cluster of confusion, anxiety, fatigue, mental, non-clarity. It's not a diagnosis itself. It's basically, it's symptoms that are in a bunch of other diagnoses. And it can be anything from sleep disorders, vitamin deficiencies, gut issues, hormonal changes, other underlying conditions like MS. So basically a whole fibromyalgia, a whole slew of conditions out there have brain fog in them. And one thing that I did before we started this podcast, I actually asked ChatGPT, can brain fog be a spine issue? And I was surprised it said yes. And it said primarily from an issue at the cervical spine. And again, very surprised that it said yes. And I think most people out there would be very surprised to learn that brain fog can be coming from a spine issue. And that's really what we're here to talk about. I'm sure that lack of sleep, vitamin deficiencies, gut issues, etc., can also cause brain fog. But I know that the spine can cause brain fog, and I think a lot of people out there don't know that.
Yeah, so tell me about what led you to the path to find that the spine had any connection to the brain.
It was
symptom.
It was kind of on accident, like a good amount of the other odd conditions that we treat. Treating patients for different conditions. So the main area that I've seen attribute to this brain fog, and these clusters of symptoms too, other than like the confusion, the non-mental clarity, the anxiety portion of it, generalized fatigue, maybe headaches, and maybe chronic pain. Those patients out there that have those cluster of symptoms, and they're going out there and they're getting imaged and screened and examined, and nobody's really finding anything. If you're out there and that's you, I would start to think, hey, my thoracic area of my spine, and doing actual treatment targeted at that area. So the way it came about was just treating that area to treat other pathologies. So like treating headaches, somebody that came in with headaches, or somebody that came in with shoulder pain, where we do a lot of thoracic spine work. And as we're treating over the years, these patients are starting to say, hey, by the way, I'm sleeping better. Or hey, by the way, I feel like I have more energy. And, not all of them are sharing this. Like not all shoulder patients are saying this, and not all headache patients are saying this. So it took a while to kind of correlate cause and effect, where we were working on the body to what other symptoms were also improving. And then it was kind of just by a friend of a friend who was going through some issues, and this will be the guy you meet next week. And he was doing exactly what I said. He was seeing all the appropriate people, his doctor, his neurologist, trying treatment, and nobody's finding any underlying cause. None of the treatments are working, and he's having some pretty severe issues. And my friend said, do you think you could help? And I said, I have no idea, but I'm willing to at least look. I'm willing to, evaluate him and see. And so going into it, I go in pretty kind of open-minded, where I've never treated this directly before, right? This is the first person that's ever come in directly for quote-unquote brain fog. So I don't really know, like with your thumb, if you come in with a thumb issue, I know I'm going to be looking at your neck, specifically C5, C6. Like, it's pretty specific. With this issue, no idea. So kind of evaluate him, and as we're evaluating a spine, the area right around like T4 to T8, so kind of that mid upper back area, was just real painful for him. And this he's a big guy. He's, hockey player, just, he looks thick, like he looks strong. And barely putting any pressure on this area, and he's jumping off the table. And you're like, oh, okay, well, at least I found an area of your spine that, is involved. Whether or not treating that fixes your symptoms, give me a few weeks and we'll see. And that's pretty much what happened.
It's pretty awesome. From what you've described, I mean, that it was really impairing like his life, experiencing those kind of symptoms. So
pretty significantly. I mean, he was having memory loss issues. He was having difficulties at work. He was having difficulties with his personal life, just day-to-day managing his day-to-day activities. And so I'm assuming there's a lot of people out there with the same. And I think that underlying fatigue, that might be one of like the hardest ones, because that can almost feel like depression. It can feel like you have no energy to do anything. And that lack of energy turns into lack of care. Like you want to do something, but you can't, so you don't go out with your friends. You might not go to your kid's game, or if you do, you can't be there for that long. If you're not doing your house chores, you're not keeping up, you're not cooking your meals, you're ordering out more. You're really just inactive, and it's because you don't have that energy level. And I think that's one of the biggest ones. And for a lot of these people out there too, I think sleep disturbances, and I've noticed this in my career, again, that area of your thoracic spine, if you sleep on your back or specifically on your sides, you put a lot of stress on that thoracic spine, and if you have an issue, you're going to be tossing and turning all night.
So for your thoracic spine, you advocate sleeping on your stomach?
No, I advocate treating the thoracic spine so that way it's not a problem, and you can sleep whatever position that you want.
Want to? Yeah, it's hard to force yourself to sleep in a position your body does not want to.
No, I do think you should be able to sleep in any position, stomach, back, or side. And like I said, certain positions tax certain areas of your body more or less, but you should be flexible enough, healthy enough, strong enough that you can pretty much fall asleep in any position.
If you'd like an appointment, go to thespinaltruth.com and schedule today. We offer both in-person and telehealth appointments, and unlike the medical system, we look to the root of your problem. We look to find the cause, the why your symptoms are there in the first place, and we expect quick improvement. We expect improvement in pain, range of motion, or strength in the first visit, and 50% or more improvement in most conditions within 4 to 5 sessions. So if you're tired of being in pain, if you're tired of the medical system and its approach failing you, and you want something different, go to thespinaltruth.com and schedule today. Now let's get back to the show.
Yeah, I feel like once you're asleep, your body takes over. You don't get a lot of decisions.
Well, and so if you are waking up, it is kind of that sign. Like, obviously, it's probably not a mental issue, right? It's probably a physical issue. Your body, like what you said, just kind of takes over. And, other than like a nightmare or something like that. But like, you're tossing and turning, you're rolling, you're waking up, and it's probably because your body was in discomfort,
Yeah, it makes sense.
So a lot of these people, so now you're starting to think of like, all right, well, how can the spine cause brain fog? Well,
it's kind of where I wanted to go, put you on the spot, and like, it's easy for you to describe the nerve connections to the thumb and why treating that nerve root more proximal could be helpful, but how does that connect with your hypothesis for helping something in the brain?
I think it leads to a cluster of symptoms, and those clusters of symptoms over time will lead to this presentation. So I think there's 2 answers, and so that's my first answer. And in that, that the spine, the cervical spine and the thoracic spine, they're commonly linked to headaches, right? and then let's just say pain. We talked about sleep disturbances, but then there's also, especially in the thoracic spine, there's some involuntary parts of your body, like your heart rate, your blood pressure, your heat dissipation, stuff like that, your thermoregulation. Like that's actually controlled by areas of your thoracic spine. So now your body's kind of dysregulated, right? Your thoracic spine has links to your stomach. You know, talk about how brain fog can be because of like malabsorption issues. So like if you're having, constant diarrhea or constipation or something like that, and you're dysbiosis, right, or gastroparesis, or like just GI issues. If you're having these, and it can actually lead to mental unclarity. I need a different word than unclarity. That doesn't sound great. But so, and then when we said pain, right, and like just being in chronic pain and fatigue. So headaches, fatigue, pain, maybe some gut issues, some sleeping issues. Who wouldn't think that looks like, brain fog, right? So you have that. The other, and this one's not proven, so this one is more of a personal just thought experiment, is that it seems like your spine has a larger role in pressure regulation in your body, and your cerebral spinal fluid has that effect on the brain pressure, right? We know that the brain isn't really tolerant to too much changes in pressure. The only way to measure it is to actually stick a probe into the brain to measure like the intracranial pressure of the brain, stuff like that. If your thoracic spine, if your body is, and your CSF, like the flow of it is dysregulated, more or less, something like that, you could see it changing some of the pressure throughout your body, and specifically your central nervous system, your brain. It's pretty easy to see that would lead to symptoms that would cause brain fog, right? Or conditions that would cause brain fog, and possibly even conditions that would cause other issues, dementia. And this is something that I'd like to look into in the future, but we just haven't gotten to that yet.
So in this thought experiment, it's that restriction of movement of the spine is decreasing, and a change on the flow of the CSF.
So more putting pressure on either more putting negative pressure on the spinal cord or the nerves that regulate some of your body's autonomic systems, right? So again, like your blood pressure, your heart rate, your thermoregulation, stuff like that. So taxing those nerves, and those nerves not operating properly.
Yeah, really interesting theory. I mean, that's how we come up with new understandings and future growth, is by hypothesizing.
Yeah, and again, it's just a thought. But at the end of the day, we know, and it's nice that you could see it online, that a spine issue can cause brain fog, right? And I would think that most of the listeners out there didn't know that before this, because we, being in the medical field, didn't know that until about, 3-4 years ago, something like that? Maybe 3 years ago.
Yeah, and I wonder if Dr. Google would agree. It's interesting how ChatGPT now has
You can get it to kind of agree with
some different information. I mean, obviously our expertise is not at all in the tech world.
What do you think, Chris? Does Google think brain fog comes from the spine?
Google seems to think that a common reason for brain fog is long COVID.
Right. So long COVID was a big one, right?
Yeah.
And one thing to kind of put together what's happening when you're chronically ill, right? And sedentary. So you're chronically ill. We were more sedentary over COVID than we ever were, and we are a very, very sedentary society, right? When you're sick, you're laying in bed with a bunch of pillows, right? You're maybe sitting up. You're putting a lot of stress on that area that I'm talking about, that upper thoracic spine, mid-upper thoracic spine.
Especially when you're sick.
When I'm sick?
Yeah.
Yeah, I'm a baby when I'm sick.
You don't leave the bed?
No. But what guy isn't a baby when they're sick?
No, I bet Chris is not
You're not a baby when you're sick?
No, I'm a man. No, I got too many things going on. Don't got time to be sick.
No, I get a little head cold, I'm out.
Really?
Oh, yeah.
I get a head cold, and I've done everything that I normally do.
But you see these like parodies online. Like I see it on TikTok. It's like my husband when he's sick and he's just laying on the couch and there's a bunch of like trash around him. And then me when I'm sick and she's going around, she's cleaning, she's cooking dinner, she's like coughing into her sleeve. You know, she's carrying tissues around with her and stuff like that. And I feel like that's very accurate.
I refuse to accept that I'm sick. I act like I'm fine until I'm no longer fine.
I look at it like a vacation. I'm like, I'm sick, down.
I remember the day that I ended up getting diagnosed with mono. I was at the gym and I'm like, I am not sick. I'm just gonna work this out. And of course I got way sicker. So the technique doesn't always work in your favor, but
so the point
back
though being,
to brain fog.
yeah, that if you're just sedentary and you're laying in bed with 2-3 pillows, you know, jacking your head up for hours, days, that could very likely lead to this problem or these symptoms. And it gets kind of miscorrelated. And I'm not saying long COVID doesn't cause brain fog. All we're saying here is that a spine issue can lead to the exact same symptoms and nobody's really looking at it, right?
When you have long COVID, you were probably sick for an extended period of time, right? And what do you do when you're sick? You play on your phone or your computer or rest.
Right.
Not...
You watch TV, either sitting or laying down, probably more so, right? Chris isn't. Chris doesn't lay down.
I've never once laid down. Question for you though. What is the typical treatment for brain fog?
It would be treating what you think the underlying cause is. So let's say you think it's fibromyalgia, you treat fibromyalgia. You think it's a sleep issue, you treat the sleep issue. You think it's a GI issue, you treat the GI issue. You think it was COVID, you treat that issue, right? So it's treating what you think brain fog is, because brain fog isn't a diagnosis itself, it's a symptom of other diagnoses. So you're just trying to figure out what umbrella of brain fog that your brain fog goes under, and then you're treating that.
If you're out there and you're in pain, if you're tired of the current medical system failing you over and over and over again, just giving you answers that numb you, pacify you to your symptoms, and are largely based on medication, injections, and surgery, and you want a different way, maybe even a better way, look for my book, The Spinal Truth, A New World of Medicine. In it, each chapter I talk about a different symptom, different condition, different body part, and how I view it a little bit differently than the current medical system and how my treatment has helped so many people out there when they've been let down with the typical approach. This is the way I think medicine should be. This is the change in healthcare I think we deserve. So thespinaltruth.com, you can look for my book on Amazon, Kindle, Apple, and on audio.
It does make sense the way you're describing it because it could be so open. It could be like, well, a treatment for brain fog is getting more sleep. But in reality, if you're sleeping in a position or causing issues with your neck, you could be worsening your brain fog, right?
Right, and you can try to change your sleep position all you want, but it's not going to work.
And then some of the other offers or solutions are, hey, you have a vitamin deficiency.
So take a vitamin, yeah.
Yeah.
But it's such a wide net that it's so hard to find the right treatment method. And I guess that's why so many people experience it, right?
Well, and for so long too. And I think this is really where, and I think more and more people are realizing this, that you need to advocate for your care. And that's kind of the whole point of what we're doing here on this channel, on TikTok, is we're just trying to give you more information so that way you can tell your doctor. Like I just saw, not to get off topic, but just the other day, I had a guy message me about, he had a labral tear, he saw one of our posts, and he said, I'm set to have surgery, and he was saying that he's having numbness down his arm. And in my video, I said that was exactly my situation in college. A labral tear can't cause numbness. And so now he's rethinking, now he's like, I'll definitely bring it up with my doctor. Good, you should. Because you should say like, well, I have a labral tear. Does labral tear cause numbness? Well, then why are you saying that that's my problem? Same thing here. Like, you need to know that, hey, it could also be a spine issue, and you're going to your doctor, and they're saying like, oh, well, you have a vitamin deficiency, but you've been taking vitamins for the last 3 months, and it's not getting better. But you know that you've had some shoulder pain or scapular pain or something like that, and you're like, hey, could it be coming from my spine? You'll probably still get a no, but at least you're trying to push and advocate for for something that you might know for you specifically is a problem.
Yeah, and a lot of the treatments, like they do say, like get more sleep. Well, that's just a positive thing either way. But if you're getting more sleep and it's not helping you, what does it hurt to do some specific exercises targeting your back?
Well,
May help you.
and that's my point with a lot of this too, is all I'm saying is that a lot of symptoms and conditions out there are misdiagnosed and can be a spine issue. B, if you do the right treatment, you'll get better relatively quickly. 3 to 4 weeks for most symptoms, you'll see about 50% improvement. If that's the case, you have now likely averted long-term medication, if not lifelong medication, and the side effects that ensue with it, and or surgery.
Now, I know we're going to get into next week with Ken, who had a whole range of problems associated with brain fog. But is that a thing? Okay, I guess my question is, does it come in levels? Because his seemed to get extreme, like he was having.
Oh, sure. Well, and I mean, so he was absolutely the worst I've ever seen.
Yeah.
So yeah, I mean, and it comes in levels just like your shoulder pain can come in levels, right? Like how long you've had it, how global it is. Is it just like one level? Is it multiple levels? You know, and again, so you have to start to look at cluster of symptoms too. And in general, it's like headaches, fatigue, shoulder pain, upper back, neck pain, any type of like weakness into the arms. And now you're also adding like that, you know, mental disclarity. How do you say the negative of that? Mental non-clarity. Unclarity? Unclarity doesn't sound right.
Non-clarity would be
Like a haze.
unclear, vague, indistinct, says Google.
I was looking for the negative.
Clouded?
Your mental cloudiness.
That's not good either.
No, it's not good either.
Well, that's why the term brain fog came about, it sounds like.
Because you sound like an asshole when you're trying to say unclarity. There you go. So then you add that brain fog, you know, symptom into it too. And the problem is now you have a whole bunch of symptoms that on their own have a whole bunch of explanations and specialists. And now you're going down the rabbit hole of seeing your primary and your GI and your neurologist and your ENT and going for a sleep study and going to like a functional medicine doctor for, you know, vitamin and nutrient. And now you're just, and not that any of those are bad, but it might be able to be avoided in a pretty quick time frame.
So, in your experience in treating someone with brain fog, is there a specific movement or part of their spine or back that caused pain that someone at home potentially has right now and is experiencing brain fog that might be like a good sign that maybe there is a back problem or a spine problem for them?
So are you asking for a movement that makes it worse?
So like, yeah, something they do or that would be noticeable to them. They're like, oh, maybe I do need treatment in my back.
So anything that rounds that upper back, which unfortunately like it's sitting, right?
Yeah.
But specifically that with reaching. So the more you reach forward, the more, so like boxing would be one, right? Rowing. But even like mouse work or something like that, like using a computer, you know, cooking, reaching your hands down for a long period of time, that is probably going to make you feel worse more quickly.
Gotcha. Okay.
Yeah, so that's a good question. And then again, the treatment, if Chris, you being here for how long? Rounding your upper back and reaching makes it worse. How do you make it better?
You know how to make it better. You get one of those things and you roll your back out.
Yeah, you do the opposite,
Yeah,
right? You
yeah.
extend your upper back and you bring your arms behind you and you strengthen in that area. And again,
Foam roller action.
foam roller. Love the foam roller.
Yep.
Shout out to Rolga.
Yeah, seriously.
What percentage of patients do you think in the past year are sharing this kind of symptom with you, of brain fog?
I wouldn't say a lot.
No.
No.
I don't think I would think to share that with a PT.
No, and nor would I, right? And again, brain fog, it's a cluster of other symptoms, and it's a symptom underlying in another diagnosis. So they're not going out and getting treated for just brain fog, you know, and they're, like I just said, they're getting treated for their sleep issue, they're getting treated for their headaches, they're getting treated for their fatigue or their global pain or their GI issue. And again, that like even just saying GI issues, boy, you can see 13 different people and get 20 different diagnoses and 30 different treatment options that range from anywhere from elimination diets to
surgery.
I think one of the most concerning things about brain fog is that a lot of the symptoms to me as a layman seem like a neurological.
Well, and so you need to rule that out.
Yeah.
Right? Once that's ruled out though, so in anything in medicine, you need to rule out the nefarious. Like you need to rule out cancer. You need to rule out an underlying, significant cause, MS, and specifically talking about like this type of symptoms. But once that's ruled out, then in almost anything in medicine, then the next thing that I would do would be then rule out the spine. And people are going to say, well, I had an image. And we have a post coming out tonight about how imaging is more misleading and inaccurate than most people realize. Most people don't know, like we were talking about the labral tears, that when you're 50, you're about 65% likely to have an asymptomatic labral tear, meaning you've had a labral tear, but it is not causing pain. But you get imaged, it's going to find that, and they're going to say this is your problem. Additionally, you can have just a shit ton wrong with your spine, and it looks pretty good on the image. Specifically the thoracic spine. Thoracic spine, not too many changes on imaging as compared to the cervical and lumbar spine.
Well, imaging is in like a position of maybe you're lying down, maybe you're standing up, but you're not doing your activity.
Well, for the most part, you're lying down, right?
Provokes pain.
So, and this is what I tell people too, that it's already an inaccurate picture of yourself, right? You're lying down in a position of comfort. And unless that's the position that provokes your symptoms, which for most people it isn't, then you're probably not getting the true image of what's going on, right? So how would I rule it out, or how do I suggest ruling it out? You treat it for like 2-3 weeks. 2-3 weeks of doing some movements targeted at an area. Do some strengthening targeted in that range of that area. If it changes, great.
Maybe this is a really dumb question.
Probably.
I'll just go with, yeah, it is a dumb question. If there is problem back there in your spine, inflammation in that area, if you take over-the-counter drugs that reduce inflammation temporarily, would that affect your brain fog symptom?
So that's actually not a bad question. It's not as dumb as I thought it was going to be, Chris.
Just wait for the next one.
So the inflammation was a symptom of the underlying cause, right? Mm-hmm. So you're still just treating the symptom. Yes, if the inflammation was there and putting some pressure on the nerves, and you take anti-inflammatories, takes pressure off the nerves, should help. But how long does anti-inflammatories last for, right? 4 to 6 hours, something more like that. Maybe it took the inflammation down. Eventually, if you didn't fix the underlying cause and you didn't know to stop doing some of the provocative things, temporarily at least, reaching forward, rounding, staying in those positions for a long period of time, your inflammation is just going to come back. And now you just keep taking this medication, which is bad for you, or you get to higher level medication, which is bad for you, right? And you're also you're kind of numbing yourself to your symptoms. You know how we're talking about like when you sleep and you're rolling around because your body's telling you it's uncomfortable? Well, if you take that discomfort away from your body, it doesn't know to change your position. And now you're putting more stress over a longer period of time than you would have because you're not feeling your symptoms.
Okay. Yeah, I guess my thought was if you're experiencing brain fog and back pain or whatever, and you take something and it reduces those symptoms, that's probably a good sign.
Could it be a sign that it was causing? Yeah. I could definitely see that. But that in that situation, so let's say the disc is pushing on a nerve, the disc isn't inflammatory, it wouldn't respond to anti-inflammatories, right? So like you can still have a back issue in your situation, which is plausible, right? Like it's only if the inflammation was contributing to more pressure on the joint, the nerves, stuff like that. Yeah, so who knew brain fog can come from the spine? And again, 3-4 years ago, I didn't. 3-4 years ago, I didn't know what brain fog was. But hopefully listening to this, it just gave you another avenue if you're struggling with this, because it can be a long-term struggle, because these symptoms, they can all be there at once. One can be more prevalent than the other for a while, and then the other one, you know, it's a sleep issue for a while, it's a headache issue for a while, it's a mental non-clarity, disclarity, right? Man, we really need a term for that. It's GI symptoms. It's
Fogginess.
foggy. Ooh, I kind of like that. Mental
Brain
fogginess
fog.
issue. Yeah, how'd you arrive at that?
I don't know.
But if you have been dealing with this and you're still suffering with it and you're not getting the improvements, changes that you want, hopefully we shed some light on it. So that's our episode. Next week, we meet and interview somebody who is going through all of these symptoms. So if you want to hear his story, if you want to see how he responded, stay tuned for next week's episode.